Dr. Batanka, can you tell us how many people in our area are affected by strokes?
Um, in UK, we're going to get about 150,000 strokes. In area like Leeds, we have 3.2 million. We expect about 3 million, about 300 strokes a year, and we're talking about uh, large strokes.
What about Oxfordshire? Do you have any figures for
Um,
the southeast?
um for Oxford, not. I think it's about 100. I don't know how much John Radcliffe, which is the place which would provide this treatment, is covers. I didn't know the exact figure of that.
Can you just talk me through what actually causes a stroke?
Well, stroke is caused by a blockage of the blood vessel. So that either it's a clot that forms if there is some problem with the blood vessel, or a clot comes from some other part of the brain, other part of the body, but usually from the heart, and then it blocks the blood vessel in the brain and causes disturbance of the flow, and then the brain cells get starved of oxygen and then die.
Is there any way that we can detect? Are there any early warning signs that this, in fact, may affect a person?
Um, early signs to detect stroke is when the face usually drops, you get weakness in your hand, or usually one side, and the speech can get affected. It's the commonest symptoms. Some other symptoms depends where the stroke, which part of the brain it gets affected. There are certain risk factors that can be identified, particularly blood pressure, cholesterol, diabetes, people with atrial fibrillation, and certain ethnic groups like South Asian or Africo-Caribbean patients who have high blood pressure, and these are more have a high risk for strokes.
Dr. Patanka, we normally associate strokes with older people, but in fact, that's a misconception.
Absolutely, I think that's very important. Um, Children can get strokes. They can get different types of strokes, but they can get the same type of strokes which older people get too, and younger people get. I treated last week a 40-year-old, and I've treated 20-year-old, and I've treated about seven children in Leeds. So it's not uncommon.
Can a child make a full recovery from a stroke if affected by this?
I think this is very important question. Children do better than the older people because the children's brain is different and it works differently. And if you look at Saad, I wouldn't recognize him anymore, and you can't tell that he had a stroke.
We're going to speak to Saad's father in just a couple of moments' time, but I just want to ask you about this new treatment. Can you explain it?
Yeah, the new treatment is using a stent. So what we do is you negotiate just like you can do cardiac, put a stent. You can use a blood vessel in your groin and negotiate or take a catheter into the blocked vessel in the brain, and then use that catheter to through the catheter put a stent, and that stent will open the artery, and first it establishes the flow, and then you can use the stent to pull the clot and the blockage from the blood vessel. It's called a mechanical clot retrieval or thrombectomy, but it's basically a very simple, easy procedure to do for people like who are already doing brain interventions. It's not a very complicated procedure compared to a lot of other things we do. All we're doing is go up to the brain, 10 minutes, pull the clot out, take it out.
And the stent and the things that you mentioned that you inserted,
Yeah.
is that there for life?
No, not at all. It's you get the stent in, you across the clot, wait for 5 minutes, let the clot settle in, and you pull the clot along with the stent, and you pull it out. Your stent comes out, the clot comes out.
So obviously, as you said, in a younger person, the recovery may in fact be fantastic and 100%. But what about in an older person? Is the success rate as dramatic?
The older it all depends on the time. How fast can you come? The most important thing which I'm trying to get to people is come quickly. Come too quickly to the place where this gets offered. It's not offered everywhere else. It's not offered in all the stroke centers. At the moment, it's offered only in the centers where the neuro interventionists are available. So you got to come there. And if the earlier you come, the better it is. And there are 5 trials unanimously say 50% improvement in outcome compared to the existing. So twice the improvement compared to the existing treatments. 70% recanalization rate. So if you have a clot, which is a big artery, and you give drugs, you got 20% chance of recanalization. So if you can't open the artery, they're not going to do well mostly. But if you use these stents, you got 82% recanalization rates, and these are early days. And I'm sure in time you may have 100% recanalization rate. But it's very important to come very, very quickly to the centers that offer treatment.
Early days, like you say, but exciting breakthroughs, really, in medical advancements, and also something that is now offered at the John Radcliffe Hospital.
Yes, I think so. I think John Radcliffe have got my colleagues who do exactly the same thing, and we do a lot of complicated stuff. And this is not the most complicated stuff I do. The thing is, the benefit of the treatment is much better than many other things I do. And there are lots of centers that you can get, the information about it, the Stroke Association, you look at the guidelines, you'll get all that information. But what you need to know, you got a large stroke, you have to be in a place where people can do this treatment.